Good afternoon, everyone, and welcome to our COVID-19 pandemic planning webinar for May 8th, 2020. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs at HHS, and I'm pleased to be moderating today's webinar with a panelist of colleagues here to talk about various items that have been arising at the staff COVID-19 email line, and also just some recent developments around work in progress to address the pandemic. So first I'll introduce who's on the line with me today. I am joined by our President and CEO, Rob MacIsaac, Dr. Dominik Mertz, the Medical Director of Infection Prevention and Control, Sharon Pierson, Vice President of Community Medicine and Population Health, Michele Leroux, Vice President of Human Resources, and Michelle Cassidy, our Healthy Workplace Coordinator. Part of today's discussion. Rob, I want to go to you first. Talk to us a bit about where we're at in the overall pandemic planning, and in particular this week.
Yeah, thanks very much, Aaron. And thanks everybody for listening into today's webinar. You know, our objective throughout this series has been to keep our workforce apprised of the latest updates throughout the COVID pandemic. And in looking back, thousands have tuned in over the weeks. So I hope you found these updates helpful. Beginning next week, our webinars will transition to a live town hall format occurring on a bi-weekly basis. So we're excited to move into that new format and hope it will be engaging. We'll expand our focus to cover corporate news and updates. We won't just limit ourselves to COVID, although undoubtedly that will be a significant part of those sessions as well. So stay tuned for the details for next week's town hall in your inbox. I do want to take a moment just to have a brief celebration, and it's of our nurses. As I'm sure many of you know, next week is Nursing Week. So I wanted to say how grateful I am for the incredible contributions of nurses across HHS, particularly over the last number of months as we've gone through this pandemic. Despite challenging circumstances, the care our nurses have provided to the community has been really outstanding. So I would just encourage everybody to take some time to thank a nurse in the coming days, wherever and whenever you're able to do so. I'm sure many of you are wondering what's next on the horizon for Hamilton Health Sciences. Last week, I sent out an update that outlined the work underway to set us on a path towards a new normal. Premier Ford has released a plan for the reopening of businesses and services in the province. I'm sure you've heard this by now in the news. And although the economy is slowly opening back up, I think all of us in healthcare know we're not out of the COVID-19 woods yet, and likely will not be for some time. Just this week, Ontario Health provided guidance to hospitals for the resumption of clinical services. We've been formulating our own plan for many weeks, and I'm pleased to say that as we look at the provincial guidelines that have just been released and compare it to the work that we've been doing, we are well aligned with the province. It's going to take some time before we can begin resuming clinical services on a significant scale. This is complex work. It requires very careful consideration, and there will also be continued guidance from the province as we move into this next phase. We will lean heavily on input from leaders, staff, and physicians. We will follow an ethical framework rooted in the best interests of our patients and our community. As you'll recall, earlier in 2020, we were well into our plans to transform a number of aspects of Hamilton Health Sciences. Our transformation work remains central to HHS's sustainability and our future. Some transformational projects, such as our Managed Equipment Service Initiative, have continued to evolve even during the pandemic. Other parts of our transformation agenda will resume in the coming weeks and months. We'll continue to provide regular updates as this process of reintegration moves forward. And I anticipate we'll be able to tell you more at next week's town hall. I know I speak for all the senior leaders on this webinar when I say how much I appreciate the commitment you've shown to take on new and different work as we work to fill many needs across the organization. About 300 people have stepped up to work at our screening centers and our employee health offices, and to help with other areas where we've experienced staff shortages. We very much hope we can continue to rely on your flexibility and commitment as we ramp up our services in the coming days and weeks. And Michele Leroux is going to speak more about that redeployment process shortly. Finally, I'm proud of our ongoing commitment to our people's mental well-being and resilience. A new resilience tool, the COPE phone line, is now available to all staff and physicians. A lot of people have worked really hard in the recent months to establish a comprehensive set of tools to support our workforce during these very challenging times. Michelle Cassidy will speak about the COPE line later in the webinar. It's a fitting topic as we recognize Mental Health Week this week. In closing, thanks again for listening today. I'm looking forward to connecting with you live next week and answering any questions you have about current and future activities at HHS. Thanks so much, and back to you, Aaron.
Thanks a lot, Rob. Dr. Dominik Mertz, I want to go to you next, as we have in these webinars, to talk a little bit about what you're seeing in terms of the trends for the pandemic locally and provincially. Where are we at, and what should we be paying attention to?
Yes, thanks, Aaron. I start off as usual with how our current numbers look like in Hamilton. So far we had 474 patients since we identified the first case here locally. Roughly 13% of these patients needed hospital admission. We have 5% deaths. As you know, this is a relatively high number. Keep in mind that the vast majority of these deaths were related to nursing home outbreaks. Roughly 2/3 of these cases have been resolved by now, which means that we still have a sizable number of people out there who wait for their final clearance. On the next slide, you can see how our epidemic curve is moving, and again using here the modeling data from the Toronto group, which shows you again every model is wrong, but in general I would say we are moving more or less within the area of uncertainty that the model would have predicted. We are sitting between 0 and 10 cases per day now for more than a week already, but we aren't down to 0 to 1 case as the model would have predicted. On the next slide, I'm showing you the data from an Ontario perspective from the public health website. Please disregard the last bar there. May 6 was in the 3 or even 400s, depending on which source you use. But we certainly see that the peak was mid-April and that we are declining in terms of Ontario-wide data as well, and not only in Hamilton. Keeping in mind that most of the data that you see here is driven by Toronto, which had their peak later than we had locally in Hamilton.
Dr. Mertz, we've heard the Premier talk about increasing testing. What will more tests in the region mean for our community?
So first of all, I would like to go back to the rationale why the Premier and also like federal leaders ask for more tests. The rationale is that is the assumption that with more testing, we get a better handle on what's actually going on in the community and to make sure that we don't miss any cases. The focus should be on doing the right test in the right patient. And that's something people occasionally don't put as much weight on. When you're looking here at the numbers of tests, it certainly increased until the end of April. So these are the blue bars here, number of tests completed in Ontario, and there had been a drop after that. But that also reflects the fact that the epidemiology is changing, and as such, there's less people sick and therefore less tests needed. We are already testing here locally very broadly based on mild symptoms. So we are not only focusing on the initial symptoms like cough, shortness of breath, and fever. We have a long list of atypical symptoms which rarely are related to COVID-19, but can be. And I think that's the approach that we would like to continue. So you have a very low threshold based on symptoms to test patients, and this will continue. What you certainly see with adding atypical testing or testing based on atypical or minor symptoms, you see a drop in the percentage of people who test positive, and that's your purple line here. Initially, it was in the 10% range. In the meantime, it's around 5%. So the lower the pretest probability in someone we test is, the lower that proportion will fall. And the same applies with an epidemiology that turns to less cases. You will see this percentage drop even further. As you probably know, there's mass testing happening through public health in long-term care facilities. They start in childcare now as well. You can expect very low percentage of patients being positive, or residents or staff being positive. This will drive this percentage positive even further down. Looking at our local data in Hamilton with asymptomatic testing, as you know, we test before surgical procedures, before ulcer-generating medical procedures, and so on. We are at far less than 1% of those tests being positive. So far, I'm only aware of 2 cases that we picked up that were entirely asymptomatic out of far more than 500-600 tests to date. Back to you, Aaron.
Thanks very much, Dominik. Sharon Pierson, I'd like to go to you next. Hospital support for long-term care homes, which we know have been particularly impacted by this pandemic, has really been an issue of focus in the last several weeks. Can you talk a bit about what HHS is doing to support our partners in the long-term care home sector?
Hi, Aaron. Thanks. I can. And as you would know and others, the Premier did ask several weeks ago if the hospitals could play a more direct and a much more active role in working not only with our long-term care homes, but with our retirement homes and other congregate settings in our community. And HHS has been doing that, and there's a lot of work underway to support our homes. And just to clarify, that support, that might be staffing. It could be help with completing the testing in the homes, which is underway now in long-term care, or it could be around education with infection control or PPE practices. So there's lots we can do to support the homes. Very practically, we've been working with St. Joe's because there are a large number of homes in Hamilton, and we've aligned the homes to either one of our organizations. So HHS is working directly with 35 retirement homes and long-term care homes in our community right now. And one of the pieces of work that's underway, and it's a critical piece of work, is completing a health, safety, and risk assessment with our homes, along with an infection control assessment. And it's not as if these homes do not have these standards in place, but it's really important that before we deploy our staff, that we're working through a joint process with our homes. So that is the current focus, along with ourselves, with public health, and certainly with our union partners to complete that. The one thing I would want to highlight, though, is that while this work is underway, we are not ignoring any concerns that come forward from our homes, and we've been in touch with all of them. And we have had opportunity to provide some supports to those homes. And Michelle's going to talk a little bit more of one of the examples now that is underway. when she speaks in a few moments.
So staff and physicians can volunteer to be deployed into these homes. How does that process work?
Yes, we're happy to receive volunteers from our physician partners along with any of the staff at HHS, and we've been thrilled with the response that we got from our request that Rob issued a few weeks ago.
And what would anyone that volunteers, what kinds of things could they be expected to do once deployed?
The most significant challenge that the long-term care homes are facing are with their healthcare aid complement of staffing right now. So a lot of the activities relate to roles that align specifically to that discipline. There are needs though related to nutrition support. It could be administrative support in the home, education support. So we're seeing a number of opportunities that we can lend HHS resources to the homes.
Thanks very much, Sharon, for that update. And certainly deployment in those settings is important. We're also our own organization. Michele Leroux, I know a lot of important work is underway and has been moving forward over recent weeks very well. What do people know today, need to know right now about our own redeployment efforts?
Thanks, Aaron. You're right, redeployment's been underway for a number of weeks now. We've redeployed over 300 people to various areas. We're very thankful for their support, both of staff and physicians who helped us out as we've moved through the past couple of weeks. Right now, we still have more supply than demand, but as Sharon mentioned, this is changing as we go to support our long-term care homes, retirement homes, and other areas of need. So maybe I could just speak to that very quickly. Just to say thank you again to everybody who's volunteered and who's helped out. When we're looking at deployment as it relates to our long-term care and retirement homes, we're trying to match our staff with the skill set that's required by the home to make sure we're providing the appropriate orientation, supply of PPE, and of course, safely return our staff back to HHS when they're no longer needed at our retirement homes or long-term care homes. On all of this, of course, is occurring while we're making sure, as Sharon mentioned, that we can support our operational needs of HHS. Thanks, Aaron.
And another topic that's been coming up on our email hotline has been pandemic pay. Maybe if I could ask you to speak a little bit to, where are we at with that process? What do we know today, and what information are we still waiting for?
Thanks, Aaron. So definitely a hot topic across all of our peer hospitals and at HHS also. It continues to evolve. We got more information this week from the government, but still awaiting kind of more operational aspects of it that we're anticipating we'll receive around the 15th. So next week we should know more. But again, we know that there are eligible workers who will receive additional pay. We're just looking at how that'll operationalize and continued details around who that impacts. So more to come for sure.
Thanks very much. Michele Cassidy, I'd like to go to you next to talk a bit about our resilience efforts for our workforce. Your team's been developing a number of tools and resources. Can you talk a bit about what are some of the ways teams and individuals are using the resources we've produced today?
Yes, absolutely. Happy to share that, as you've heard over the last few weeks, there are several initiatives that have launched designed to support staff resilience and mental health. And some of the ways we're seeing those integrated, you're seeing the resilience toolkit up on the screen right now. And this is a series of tools that help us check in with where we're at in terms of our own resilience, our stress level. And we're seeing that these tools are being used in CQI huddles where people are integrating practices either at the beginning of a huddle or at the end of a huddle, in our safety huddles, as well as many leaders are using parts of this toolkit at the onset of meetings or to close a meeting. We also know that many units have created staff lounges or quiet rooms, spaces where our staff can take a break and have some quiet time. And the resilience toolkits have been placed in those quiet rooms so that staff can, in a self-directed way, use that toolkit as they need to. Certainly over the next little while, you'll see that we're going to continue to build the resources in that toolkit. We know that many of you are at home with families, and so we will have some family resources that will be added to that toolkit shortly. The other area of support that we have offered is leadership support. So there are bi-weekly webinars that are happening, as well as coaching. And we know that yesterday on our resilience webinar for leadership, we had over 100 leaders attend that and learn about these practices, which we expect will then be integrated into team support. Another area that we are really excited about is that we have partnered with the We Care team, and we are working very hard to get wellness items and items of comfort for staff so that those can be placed on units to allow staff to feel supported and to have items that might make the challenging time that they might be experiencing right now just a little bit easier.
Wonderful. Can you talk a little bit about the peer support cope line? Who's it for, and who are the people talking to when they call in? And what kind of feedback are you getting about the cope line so far?
Absolutely. We're very excited about this, our latest resilience initiative. We're only a week and a half into the launch of the cope line, but this is a 24/7 peer support telephone line. We know that for many of us, healthcare staff and physicians are living quite a different reality from the rest of the world right now. And it can certainly feel isolating. It's hard to know, how do I talk to somebody, or how do I talk to my family whose experience right now is very dissimilar to what I'm facing on a daily basis. So we know how isolating this can be. And the peer support line is intended to help our staff and physicians connect with someone who has a shared experience right now. It's a line that you can call if you've had a tough shift or a difficult day, or if you just need a little place to decompress, or perhaps a place where you call at the start of a shift if you're feeling any sense of anxiety coming into your shift. It's not a crisis line, and I think we want to be clear, because some of our staff have said, I'm not in a mental health crisis, so I don't need to call that line. So wanting to make sure that people know that this is a line you can call really just to connect with somebody and to share about your daily experience, or to get some tips, or to perhaps be supported with running through one of the practices in the resilience support toolkit. Those who are on the line are redeployed staff. We're all HHS staff members, a lot of different disciplines. Some of us are working on units right now and have shifts to cover the phone line, and some of us are redeployed staff working from home and answering the line. We're all people who are very passionate about supporting staff and physician resilience, and we're really excited about the opportunity to take the calls and to just offer that listening ear. The types of calls that are coming in are, people talking about if they've had a difficult shift and they want to debrief that, or maybe they have some family pressures right now because things look so different and they want some advice on supporting their child or youth, as well as some of those that are redeployed perhaps and have some stress related to their redeployment. So we're really happy to know that people are calling for all sorts of different reasons, and the feedback so far has been very great. People are finding this a soft place to land, so to speak, and a place where they can just speak unedited with somebody else who gets it, who's living a similar reality right now. We also know that one question that's come up a few times is, what if I call the line and the person answering is somebody that I might know? So we want people to know that we have 4 staff on the line at any given time. And so if you feel that you know somebody who has answered your call, you can request to be transferred to another peer supporter, and we're happy to make that happen. I think over the next couple of weeks, what you're going to see coming out in some of our communications is little videos that are going to introduce you to who the peer supporters are. So if you have any anxiety about calling a line and not knowing who's on the other end, you're going to be able to meet some of the people that are prepared to take your call. So stay tuned for that over the next little while, and just know that we're here, we're willing to support you, and we're ready to take your calls.
Fantastic. Thanks very much, Michele, for that update. Thank you all for joining me today and for being a part of the webinar. As always, the content for today has been shaped in part by the questions that are being asked at the staff COVID-19 email line. You can ask questions at that line. The situation for the pandemic remains evolving on a daily basis. Please do also download the Hub app, which is a great conduit to get the most up-to-date information about what's happening across Hamilton Health Sciences as we continue to adapt in our response to the pandemic, and also to learn about other things that are occurring across our organization in relation to this work and day-to-day business. We will be back next week, as Rob outlined, with a new webinar format, and look forward to being a part of that at that time. Until then, you can share this with your colleagues, and when we speak again next week, we'll have the opportunity to delve into more content. Thank you all, and until then, stay safe.